as a part of the migraine community, I recently became part of the migraine community with my daughter, who at age 6 had her first migraine, and consequently, throughout her years, she became more migraine prone. And recently, as of last year, Lexi, my now 13-year-old, suffered a migraine for over 100 days straight. So today we're talking about parenting children with migraines, hoping to share some stories and lessons learned, and also, just talking about maybe answering questions and discussing with people their situations and what they're going through at this point with having children who have migraines. But just to double back on the story, it is Migraine Awareness Month, and in honor of Father's Day soon to come, I thought it would be fun to tell my story to the rest of you. When Lexi was in 6th grade, she was 12, and she got a sinus infection that lasted for a good period of time, and we thought that was actually just a temporary thing, and she had a headache because of it. And when the headache, I should say migraine, didn't go away, 6 or 7 days later, after the antibiotics had taken care of the sinus infection, then we were kind of stuck wondering, are we in a pattern? And how did we get here, and so forth. So we began to look around for doctors for Lexi, and several weeks into it, we were visiting different neurologists and pediatricians, and trying to get some relief for her. She was in the emergency room several times, and she walks in with a number 8 or 9 migraine, and they might get that headache down in the emergency room to a 5 or a 6, but it never really went away, and by the time she got home, she'd be back up at 7 or 8 or 9. So really was no relief for her in the ER and a lot of the medicines that they were trying to give her, and we were trying to find someone that would help her and also be the right experience for her as a patient. With children, it's important to have the right doctor-patient relationship, and we went through and met several folks, and eventually we wound up at Children's Hospital of Philadelphia. So we met some great doctors there. They ran Alexa through a lot of different departments to have her checked, and we were able to kind of get the right treatment plan for her, and so she was on her journey to get out of this migraine. However, 110 days later, it finally broke, and she started to see some relief. But during those 110 days, it was rather stressful for Mom and for me, Dad, and it was a hard journey for all of us as a family. So people have asked, what did we do to get through it? How did we encourage someone who's sick and in pain constantly? And I would say, first off, we advocated for our daughter. We wanted to find the right place for her. We wanted her to like her doctor. We wanted them to have knowledge of not just medicines, but also how to treat migraine traditionally with diets and sleep and hydration and other things. So we wanted a doctor who understood that. We wanted a place where they treated the whole patient, not just the one migraine. They treated the mental side of it. They treated the physical side of it. And then they also had a good, bedside manner. So advocate for your child. That was effective for us, and that was not easy. Lots of folks will tell you they know exactly what's wrong, and if it doesn't feel right, my advice was to kind of keep on looking and make sure that you're the voice for your child, because he or she's not able to be that voice. Secondly, we really reached out to community, our community, and we needed help from many other people. Jenny's my wife, and she's full-time. She's with Alexa all day. She's the primary caregiver, and she's constantly trying to help Lexi stay positive. And that's a long day, and that's hard as the primary caregiver. And so her family and my family were really helpful in that they would come and cover and help out. And so the community was great. The principal at my daughter's school, the teachers were excellent. Even babysitters and friends helped out and offered advice, and really taking that help was a little humbling, but I think needed, because it's hard and exhausting with this situation going on. And then I'd say, you know, we also try to stay positive for her and for everybody. You know, it is a temporary thing. We didn't know that children could have it this severe, and we were constantly celebrating small wins. You know, you wake up, you feel a little bit better. That is a win. That's a step in the right direction. Some days you'll go 2 steps backwards, and just trying to be there for your child to help pick him or her up, and to encourage them to get back at it and stay focused and go pursue another day. That's kind of our role as parents. We also want to try and strengthen the relationship with Lexi. So special time talking, one-on-one relationships, even going out and doing something fun with just me and her, or my wife will do something just fun with her and Lexi, just to take your mind off it and just to be a normal kid again. You know, they just want to be a normal kid, and they want to not have to suffer with a headache or a migraine. So celebrating those small wins and staying positive is really important, and our community was very helpful with that. That was also effective. And lastly, I'd say follow doctor's orders. So, you know, our doctors had given us a lot of things to do, and I put that on Lexi. You know, she was the one that had to go and stay in shape. She had to go to the gym. She had to work out when she had a migraine. The stronger your body is, you know, the stronger your body is able to fend off illness, and especially migraines. So you want to be in the best shape you can be. Eating right, not eating junk, hydrating, getting sleep. All these things are part of, you know, of getting better. And my goal was, and Jen's goal really was, to let her be responsible for those things, because ultimately it's her own brain or head she's trying to heal. And we can make her do stuff, but in the end, it's better to kind of teach her that she's in control, and the only person that's going to fix her is really her. So those are the things we did, and we tried to follow doctor's orders and be encouraging and to help her continue in her journey. Lexi has since been through that migraine situation. There have been times when it has come back, and as of recently, and she is more armed now. She's less afraid of a migraine. She doesn't like them, of course, but she's got some tools now, and she has some experience, and she can say to herself, I did that, I got through that, I can do it again, this won't last forever. So we're really encouraged by her progress, and we were really impressed with her as a person. She's since then been an advocate for pediatric migraines. Her goal is to let other children know that they're not alone, and that it can work. You know, she can get through it, and they can too. And she's really been a really strong voice. We were hoping that she would view this as an opportunity, not to have something happen to her, but having her the chance to create something new and to affect a situation that is really national and even global. And she's really taken that on as a 13-year-old advocate. And my wife and I are really proud of her and all that she's done. So, you know, that's kind of the story about Alexa and what my wife and I have been going through. And I'm looking through some of the comments here. Denise, I'm sorry to hear that your 13-year-old also was just diagnosed with migraines, and love to hear any questions or comments you have. And Paige, yes, when they're little, you know, when the kids are small and young, and you want to have them get better, you know, it's heartbreaking. So I'm right there with you on that. Denise, you commented about medication, and that's kind of a common thing. You know, we agree that medicine is important, but we don't want to make that the primary treatment for Lexi. We think that our opinion, not that we're doctors in any light, but our opinion is that it is a full dietary and a lifestyle and stress management, as well as you know, a medical condition that needs medicine. We did not want to just drug her up and try and help her get better. That didn't work. And but for Lexi, it was a combination, and it's a very long road. Denise, you would know that the medicines they give anybody, even adults, can take weeks and months just to take effect. And it's frustrating if you try one medicine, it doesn't work. You have to slowly get off that one and then start all over a new one. So really important to try and help the child stay positive through that experience. And, you know, to try and see that this one might not work, but there's many other tools that we have, and we're just going to help you through this and try and help her or him heal as quickly as possible. Just looking through some comments, Rebecca, it is a roller coaster for sure. Warren asked, how does Lexi talk to her friends about migraine and getting them to understand that sometimes she might say no because it's a migraine, but not because of them. It's a really good question, Warren, and she even most recently has been dealing with that. Her comment to them is, hey, you know, I have a really bad headache. Thanks for asking. And she kind of says that she tries to close the conversation down with that. Thanks a lot for asking. How's it going for you? And she'll redirect. Because when you go to school, she'd say, everybody stops her and says, well, what's going on with your head? Or what's wrong? Like, I don't understand what's wrong with your head. And it's really frustrating for her. And so she tries to redirect it. But after 100 children asking you that question, you can see why you don't want to be in a social environment. But she's found success in redirecting and also just trying to shut the conversation down quickly. You know, say, my head really hurts. It's a really bad headache. Thanks for asking. And then redirect, how's it going for you? What have you been doing, or anything else like that? So social media is hard for her. She doesn't text or FaceTime or anything because, you know, it gives her a headache. You know, when you look at screens, it's not easy to read or not easy to see. And she's, you know, she says, Dad, it gives me a headache, and then it just doesn't help. So she really doesn't do much of the electronics or devices because it becomes a little bit of a burden, I think, for her. And she's at peace with that. She's fine. She doesn't, you know, need to have her phone with her all day long. She's a great kid on that respect. Denise, yeah, we're thrilled with her advocacy as well. Mippy says, I've had migraines since 10 years old. It's hard for people to understand it. I'm glad Alexa has supporting parents. We try to be supporting parents, and I'll say, you know, I'm really, my wife is the main person in this assistance with Lexi. She's there 24/7. I'm there to help her and to try and be positive and spend what time I can with Lexi when I'm not working. So Jen gets really all the credit on this, and her family and friends. So, but we're happy that you know, it's been effective for her. Laura asked, what about teachers and coaches? Can they help? Yeah, you know, the migraine protocol for children and adults really has not been fully established yet. In my opinion, I think there is protocol for teachers, concussion children. It might be similar. You know, there are break times, and you know, the children are not required to use screens and look at the smart boards. That's kind of similar to migraine, I would think. And our daughter's school, was very helpful in that situation. They would print materials for some of the kids, and she was allowed to take breaks in a conference room or a separate room when her headache got bad. So Lexi was strong. She pushed through, and she went to school as much as she could and did as much work as she could. But the teachers, you know, to no fault of their own, I just think it's a new condition, and it's kind of hard to imagine. If you've never had a migraine, and I've had maybe 2 or 3, but nothing like the kind of migraines that my daughter and I should say my wife and her mom have had. I couldn't even imagine going to school. And so just the fact that she even did that is incredible. And I think if you haven't had one, it's kind of hard to relate. So that would be helpful. Coaches, same thing. I don't know about, what coaches could really do. I also think that some coaches are diehard. If you don't make practice or you don't get to the events, you're not really part of the team. And sometimes that perspective, when you have a little kid who wants to be a kid, that diehard perspective, I'm not sure I would really advocate for. We're helping kids get confidence and grow up and be happy children, I think, is one of our goals. And there have been some great coaches that were really supportive, especially with Lexi, and in other sports and with other children. I wonder if, the insistence on the intense schedules and so forth is necessary. But Lexi's coaches were great. I mean, they even, she missed a bunch of games, and they even invited her to the last game and acknowledged her. And so it was really nice of them to do that. I think that was really considerate and much needed. Just jumping through a couple of questions. Tammy, thanks for the comment about Lexi. She is really amazing. The American Migraine Foundation's comment, a few accommodations at school can help a child manage their migraine and give them a chance to thrive. Our guide advises parents and schools on how to work together. So great look at, I'm already behind. So the American Migraine Foundation's comment there with a link to how parents and schools can work together to move against migraine. So that's right in the comments section if you want to look at that link. That seems to be very helpful. There's also a link up higher in the thread that talks about identifying the signs of pediatric migraine. When my daughter was 6, we really didn't know what she was talking about. She said I have a headache, and we just thought she maybe bumped her head or didn't really understand what she was going through. It's hard to understand what a migraine is and to even identify it. So there's a link up here in the in this comment section for how to identify the signs of a migraine and then maintain a productive dialogue for good headache habits, I should say. So as a family, so that was a great thing for those comments. Thanks a lot. Well, listen, it's 8:25 and I'm running low on time. Sharon, hello. I can see you there. I want to thank most of you for all your comments and the American Migraine Foundation for letting me talk about this incident with Lexi. We're living in this situation as parents. It's difficult, and it's even more difficult as a migraine sufferer and as a kid, I should say. So we're just trying to understand what she's going through and put ourselves in her shoes and really be there for her when she needs us. So that's kind of where we are with this situation. Want to thank everyone for watching this podcast and your great comments. I do appreciate it. And if you ever need any other questions answered, I'm always available. You can send me a message.